Good morning. Happy Wednesday. I hope you guys are all doing well. And today we are going to cover rotator cuff injuries and get to the bottom of that. So today I'll be talking about why it is so important to make sure that your rotator cuff is healthy and strong so you can help prevent things like injuries and inflammation and impingement, and then the dreaded rotator cuff tear, which I'm sure you are all. Good morning, Lynn. How are you doing? I'd love to hear how you're doing, and congratulations on being the member of the month. So I will be in touch with you so I can get you off your gift. And then we will be covering exactly what is your rotator cuff, and I'll kind of walk you through. I have the shoulder image behind me, and then I'll include a couple screenshots of the shoulder below this video so you can kind of see. I think visually when you see inside the shoulder, it makes a little bit more sense, and you'll be able to match up maybe perhaps what you're feeling in the shoulder, certain aches and pains, and then also just kind of when I start to talk about what you can actually do to prevent the shoulder injuries. And then I'll start to talk about then how your rotator cuff gets damaged. What are the common problems or symptoms? How does it present? I like to always refer to it as what are the common culprits, and then what are kind of the do's and the don'ts that follow, having a shoulder injury, especially specifically for the rotator cuff. And then lastly, I'll touch on what to do if you're experiencing things like inflammation and impingement, or if there's a possible underlying tear. What is the possible courses of actions? Oftentimes what you'll see or be told when you go see a physician, and what are your options. So that is what we're going to cover today. If we haven't met before, my name is Dr. Yvonne Castillo, and I'm a pain-free movement specialist and doctor of physical therapy, and I specifically help women over 40 get back to being pain-free, active, and unstoppable, and all doing this naturally without having to rely on pills or potions or procedures. So I would just be curious if, drop below if you know what your rotator cuff is, if you've heard it before, if you've ever seen anybody wearing one of those slings with the pad or anything like that, or if it's something that you're aware of. I'd love for you just to drop below if you've heard of the rotator cuff, or if perhaps you do have any kind of cranky shoulders or stuff like that. I would love to know what you know and what you're experiencing. So I'll wait for those comments, but so what is your rotator cuff? And why is it so common that it tends to get injured? Why do we see shoulder injuries so common? Why does it seem like everybody seems to have one through that? So, you can imagine we use our shoulders every single day. You can't get away from it, and they just get a lot of mileage on that. And unfortunately, when most people think of doing exercise programs or activities to keep the shoulder healthy, most people will focus just on doing a lot of chest exercises or bicep exercises, and actually doing targeted rotator cuff exercises is oftentimes ignored or just omitted from programs. And then equally so, just physiologically by design, we tend to have a lot bigger muscle groups that will kind of rotate us forward, turn us inwards, and all those types of movements and positionings tends to compromise the rotator cuff. The rotator cuff is comprised of 4 muscles. They're referred to as your sits muscles, which is an easy way to remember them. Your supraspinatus that runs kind of along the side in the top of your shoulder and is responsible for abduction, which is lifting up of your shoulder. And then your supraspinatus, which sits on the front of your scapula, and I'll show it to you in just a moment. And that's responsible for internal rotation of your shoulder. And then you have 2 external rotators, and that is going to be your teres minor and then also your infraspinatus. And these are all like pretty teeny muscles in comparison to like your big pec muscles or your lats or all those things. So when you're thinking of, these little itty bitty muscles trying to stabilize your shoulder, when they're trying to work against these much larger groups of muscles, they get kind of dampened or quieted. And then also just structurally, posturally, most things that we tend to do throughout our day, it's turning, reaching in, rounding forward, lifting things up overhead. All those types of movements can kind of give the rotator cuff a little bit of a beating. So that's why it's really important to keep it strong and healthy and make sure that we have a good foundation with our upper body. Okay, and then so let me see, I'm going to try to zero in on the image behind me, but then again, I'll drop the images below so you can see it. So I'm just going to kind of spin myself around here, see if I can, oops. Oh, it doesn't want me to do that. Okay, well, I can at least do it this way. Okay, that works. Thank you for being patient with me. Okay, so this right here is your, we are looking at your rotator cuff. And right into this is your rotator cuff. So the muscle that I was speaking of before, your supraspinatus goes, this is your clavicle, and that's your arm bone right there. So that's your humerus, and this is your actual, your scapula. It's the front side of your scapula, as if we were looking to someone face on. This muscle right here is your supraspinatus, and it's responsible again for that internal rotation. You have this muscle right in through here. That is your supraspinatus. That's the one that tends to get most commonly impinged or inflamed. And that happens to do what actually happens when you get a tear. You're actually tearing some of that tendon. And that's because what happens is this arm bone will tend to knock up and punch up into that clavicle, and it starts to create little tears, or just because the habit of it just kind of bumping up on itself will create tears. And then let me see. And then behind the scapula is where you're going to see your infraspinatus and your teres minor, and those rotate it out. And let me see. I think if you can look up just a little bit higher. There we go. Like right there. That's probably a better picture of your rotator cuff. And one of your biceps actually comes in and goes underneath the clavicle and attaches into there. And it too is often damaged in your rotator cuff. And if you look up here, this is a little bit of a better picture where you start to see, there we go. That's actually a little bit better. Where you see there's your supraspinatus, and then you also have a bursa that goes up and through there. And this is actually a picture you could start to see that the bursa is inflamed. And that's because it's kind of gotten impinged into there. And if you looked up over and through here, it actually shows the motion of the arm bone moving up into abduction, and you can see it starting to get pinched up and through there. So there's your supraspinatus, and there's your subacromial bursa, and that tends to get damaged. Those are the most common structures that are damaged in through there. So what happens is the job of the rotator cuff, because if this is my like clavicle that sits in through here, and then your humeral head sits in through here. Well, what happens is your supraspinatus attaches into your humeral head, like right in through there. And what happens is its job is to pull it kind of inward, and it keeps the humeral head staying down. Now, if it's weak, what happens is as you go to lift your arm up, or you reach it out to the side or overhead, instead of just kind of spinning in your shoulder like that, what happens is it starts to migrate up. And what happens with that kind of migration up, it starts to pinch all those structures in through there, which is your rotator cuff tendons, as well as that subacromial bursa. And a little bursa is basically just like a little cushion and a sac, and they exist all over your body. And their job is basically to decrease kind of the friction force, and it offers a little bit of padding. You'll see them between tendons and bones. You have them all over your body. And what happens is with that continual kind of little like jam up, just like anything, if you were to slam your finger in your door, what happens? It gets puffy, it gets inflamed, but just kind of that repetitive motion makes it really inflamed and painful. And then the cycles that tend to happen off of that impingement is because it's painful. The arm gets weak and those muscles get turned off, and that creates like a cycle of the shoulder's not moving appropriately, the muscles aren't turning on, they become atrophied, and so it starts to just be this downward cycle. And then, like I said, there's a lot of things that we tend to do throughout the day that will just motions and movements that continue to perpetuate that injury. One of the first things that will come, when again we think about pain, we always kind of break it down into structural and then mechanical. So the structural things that will put compromise into the rotator cuff is again that really rounded posture in through there. So that rounded posture, again, that naturally will start to create lessen that gap between the shoulder and the underneath your clavicle and your scapula. So just from that natural internal rotation in already shortens that distance, and that can again start to really impinge and create irritation with all those structures in through there. And then activities. So the rotator cuff and when it's weakened or inflamed, it doesn't like a lot of overhead activities, and that's why people will have a lot of pain reaching into the cupboard. And again, kind of reaching across your body or doing this downward rotation, all those things, again, close off that joint space. Another thing that will be painful is like reaching into your back pocket for, your wallet, or putting on a tight jacket, and all those things, again, put the shoulder into a position where it doesn't have as much space. And when it's already irritated, it continues that just like cycle of irritation and inflammation. Again, you want to think too, same thing if you like slam your fingers in the car door. If you keep on slamming your fingers in the car door, it only gets more painful and more irritated. And that's essentially what's happening with the shoulder. Same thing with things like sleeping on your shoulder. Again, too, that puts a lot of compressive forces on it already on tissues that are irritated. And then what type of injuries tend to bring on rotator cuff damage will be like falls. So people falling on an outstretched hand, people falling on a shoulder this way, or slipping and catching themselves and falling with their arm behind them. A lot of throwing, people that do a lot of throwing, so like a lot of tennis and serving and swimming and stuff like that, all that puts a lot of mileage on the shoulder. And again, I'm not saying that if you do those activities you're going to for sure get a rotator cuff, but what tends to happen is when people have poor posture, their rotator cuff is weak, and they do a lot of those activities where there's a lot of like push-ups or overhead presses and stuff like that, or pull-ups, when their shoulder is not as strong and as stable as it needs to be, it kind of puts them at risk for getting tears or getting into inflammation and impingement. Another thing that tends to happen when we see that there's a weakening of the rotator cuff and there's that jamming up of the arm or the humeral head up into that space. Anytime bone contacts bone, what it does is it stimulates the like laying down and depositing of calcium, which is basically your bones. So you start to get these like little bone spurs, and they're like little teeth. And I say it's almost like having like a little serrated knife in your shoulder. So then each time, you can imagine if there's these little jagged teeth, and each time that you're hitting your arm bone hits upward, or you do anything that damages it, again, it just further kind of is like sawing down on your cuff tendons and through there. And that's why there will be an acceleration of where people will go and I see this all the time where they're like, oh, I've got like, an injury, it's kind of achy and sore. They just kind of keep push through it, doing things that they don't really realize are, not great for it. And they go from, the cycle is typically, it's inflamed, it gets impinged, and then small tears start to happen. And then in the really progressive stent, people will get like full, what they call, it's like a full thickness tear where it's completely damaged all the way through. And so how the pain will typically show up, and it's kind of an interesting thing, is the body, there's a thing called referral pain where the body can't really like pinpoint like 100% like the middle of a bullseye, like where it's coming from. And it kind of senses like, oh, it's like shoulder pain, it's coming from somewhere in your shoulder. So it's not like you'll feel the pain patterns directly actually where the structure is damaged. So when people tend to have like their biceps tendon involved where it's getting impinged, it's getting inflamed, or they'll get pain like right in the front of the shoulder. Another classic sign of referral pain that comes from the rotator cuff is they'll get it in their side. They'll feel like it'll refer to, this is your deltoid, like right in the side. People will constantly be like rubbing the outside of their shoulder. They'll be like, oh, the pain is right here. The pain is right here. And then after talking with them and taking them through like a series of assessments, it's like, no, that's for sure your rotator cuff. Or they'll get it right in the back of the shoulder and through there. And that's the impingement of some other structures that will tend to happen. But basically you kind of tease it out by, figuring out what the pain patterns is, what's causing it, checking out their range of motion and what they can and can't do. We'll kind of zero in and be like, oh yeah, that's a rotator cuff injury, and through there. So what do you do if you have shoulder pain, a problem that's associated with your rotator cuff? The biggest takeaway, I hope you take away, is do not ignore it. I can't even tell you how many people, when they finally make their way to addressing it, it's like the signs of it showing up had happened, like months before. And if they had dealt with it, like, the months before when it first started out, they could have completely avoided having a surgery. And I specialize in, I've been practicing for 10 years, but I specialize in pre and post-operative care. So I have seen every surgery on the sun. I've observed every surgery under the sun. And I specifically worked with people kind of before and after. And my big goal was try to make sure that people could avoid surgeries. But I worked with people prior to surgeries and after surgeries. And rotator cuff was something I see all the time. And it was always a blessing when people came in early, when they just had those initial signs and symptoms and stuff like that. And we were able to do work that kind of could address all the things that were actually causing the rotator cuff injury. And there's countless people, my dad isn't one of them, where he's got both tears, he's in construction, and it's he was able to avoid the surgery by just getting on a program and addressing the things that are really causing it. And this is why I'm so adamant about it. The surgery is a serious surgery. It is, you are like in a sling for several months. It's about, like, in people won't say this, but to get back 100%, it takes about 1.5 to 2 years. And it is probably one of the most painful recoveries possible. So if any way I can help people not have to go through that, that lights me up. So that's really, really important. So the number one thing I would say is do not ignore shoulder pain, kind of clicking, all that stuff, because oftentimes it's really easily to kind of nip it in the butt earlier versus as it progresses. You can imagine the more you tear it, the more it gets damaged, the more inflamed. And that's kind of the cycle that we see. It gets inflamed, it's impinged, the muscles kind of turn off because there's a level of swelling and achiness and pain. And so there's an atrophy in the muscles, and then the atrophy in the muscles can't support the shoulder. So it kind of just turns into this cycle where things just like start to go downward. And the other mistake that I see people make all the time is like, and this is not, anything on them, but it's like, they'll see, they'll Google, okay, shoulder pain, and they'll kind of see, oh, that sounds like my symptom. That sounds like my symptom. And what will pop up is, like TheraBand exercise, which are those stretchy bands. And what will pop up right away is the strengthening exercise for the rotator cuff or for the shoulder in general. And you have to be when you're dealing with any injury or anything like that, it always has to go through a progression of, like, first off, you have to kind of find exactly what's causing it. And again, you'll hear me stress this over again, but you have to think big picture and not just like it's just the shoulder. It could be a lot of different things that you're doing or that's going on in your body, these kind of weak links. But they always you'll see like, oh, just do these strengthening exercises. And that's the downfall versus like, no. First we need to, find out what's wrong, deal with the pain and inflammation, calm that down. Then we work on kind of removing the restrictions. Again, that's kind of the 3S mobility method, where it's like we remove the restrictions by releasing the tissue, and then we making sure that you're in proper alignment. And then you work on the range of motion and mobility. And then on top of that, once the pain and the swelling's gone down, that's when you're going to be integrating probably focal, like directly targeted rotator cuff strengthening exercises. But oftentimes when the shoulder has been inflamed or injured for any time, it takes a good 2-4 weeks for that inflammation to calm down. And again, we don't live in like a bubble or a vacuum. So no matter what, you're going to go through your day and you're going to be somewhat kind of quote unquote irritating the shoulder. So when people just jump straight to the strengthening and kind of try to self-diagnose, or they've been just given some exercises by friends, or, oh, these were the old PT exercises, or go to someone for the gym and they're like, oh, that's your, and they just give you those exercises when you don't honor those phases of healing. it can be worse, and you can actually accelerate a tear, because you can imagine if you have that serrated knife with those bone spurs in there and you're doing these strengthening exercises or you're really pushing it, it will only accelerate that. And I've unfortunately seen that as well. So that's another mistake that I see. So again, important things, phases of healing, going through all those phases where, again, you need to find what the problem is. We need to fix everything that's going wrong. And then you really need to make sure that you finish it out. Another big downfall that I see is as soon as people are out of pain, they think that they're like in the clear, and they don't really fix and address everything that got them there in the first place. And that's why they'll, loop back to having any issue over and over again, especially with the shoulder, especially with rotator cuffs. And so oftentimes when you go, to a physician or anything like that, they'll do, an x-ray to see if there's, impingement. You actually need an MRI to really see. The MRIs will show you, tendon damage, soft tissue damage, which is like your muscles and your tendons, and will actually show what's wrong. And sometimes those can come back like really scary, where you're like, oh my gosh, like sometimes they sound and they look on, when they write it up, a lot worse than it really is. And that's where it's really important to, anytime you get any sort of diagnostic test like blood work, x-rays, that you have to match it up with what we call like your clinical symptoms. So that means like how you're presenting with your pain, how you're presenting with what you can and can't do. And those two things can match up. I can't even tell you how many times people have like a seemingly horrific, like diagnostic test, and then you match it up with how they're limited, and that you always want to go conservative first. So you always want to actually find and fix the problems first. Then you can start to think of more kind of aggressive measures. And I've seen that. I've worked with countless people where they were actually on the surgery schedule to get, a cuff surgery, but then they go through, my program and working with me, and they've gotten off the surgery schedule. And that's not with, there's countless people, but that's someone that does, golfing or tennis. So that doesn't mean like, oh, well, you don't need the surgery, but you've also given up everything that you love. There's definitely ways to work on it, but without having to give up what you love, even if those activities can be stressful on the cuff. So typically when you go in, you'll have that kind of imaging, if that's what it is. And they'll probably want to do like a cortisone shot. Cortisone is a steroid, and it's an anti-inflammatory, and they'll often inject that right into the shoulder. The downsides, and I'm going to speak about this in a couple weeks, is that cortisone actually has, it will actually start to degrade the tissues. And I had one of the surgeons that I worked with, and he said it so beautifully, but he was like, whenever you get a cortisone injection, you're actually like taking an hourglass and you're like flipping it on its head, where like you're starting the clock to eventually needing like surgery. So that's just something to think of. There's a time and the place for them, and I'll talk about that in more depth later. But the goal of that is to knock down the inflammation and lock down the pain. So sometimes you can do your rehab. It's not necessarily something that you want to seek out. You're definitely limited. You shouldn't be getting them in any one area or overall, like within kind of closer than 3-month periods for most of the time, especially in the shoulders, because again, it has kind of it will cause some deterioration within the actual tissues, like ligaments and tendons and stuff like that, and it can cause some other things, but I'm going to talk deeper in that on another training. And then the progression from that is hopefully conservatively, doing, going to a specialist, going to a movement specialist, and getting the help that you need. And then if it really progresses, then what happens is they go in and they do orthoscopic surgery, which is they try to repair the tendon. And I think the other mistake that I see is some people, even when they're on the surgery, they're like, or just anything where they're like, oh, it's already damaged, it doesn't really matter, I can't really do it, anything worse to it. And that is like, couldn't be any farther from the truth. I've seen, unfortunately, people that have had tears, they were on the surgery schedule, and you go in there, and we're in there, and it's just completely obliterated. And what once was like small tears of one muscle, there's now full thickness tears, and more muscles are damaged in through there, and they have to do some more aggressive measures, and people are in the sling for like almost twice the time, and it's just a really, really slow recovery. So again, food for thought. if something's injured, don't just think like, oh, well, whatever, like it's already gone, it's already bad. Like I can't make it any worse, when you actually can. And some people have even gone to the extremes where it becomes almost like non-surgical, and then they have to get joint replacement. So don't do that. So that's kind of some of the progression of the more kind of aggressive measures to solve the rotator cuff problem or inflammation, impingement. And those are mostly the tears. Those are more the severe cases. So that's kind of rotator cuff in a nutshell in there. So hopefully you this made things a little bit clearer, and your ears are kind of perked up when you see things, or even just maybe when you're in conversation with friends and they're saying, oh, I have a shoulder injury, things are clicking and popping, and I've always got this pain there, and they're saying certain of the movements that they can't do. Hopefully you'll just be a good sounding board to encourage them to go seek out working with someone that can help them. So just to kind of wrap it up, today I talked about, what your rotator cuff is, and again, I'll snap some photos below this video so you can see it and kind of look at it. And please ask me any questions for any clarifications under there if you need to have any questions. And then I touched on how your rotator cuff will get damaged. What are the common culprits, problems, and then the symptoms, how that pain will present. The cycles of pain, which again, it goes from that injury to impingement to, it'll go from like injury, inflammation, impingement, and then you'll get cuff tears in through there, and then bursitis, or that inflammation of that bursa. And then lastly, what do you do if you have shoulder pain, if that rotator cuff impingement or micro tears in through there? And then the common kind of myths around it. I mean, I was just on a call with a woman yesterday who was, was having some shoulder issues, and she was doing the program that I'd given her, and she was so surprised at what a big difference it made when she was at the gym in her body pump class, skiing. She's a big cross-country skier, and she's upwards in her 70s. So again, it's never an age thing. So hopefully that was helpful. I absolutely love the shoulder and everything shoulders, but I love everything about the body. So hopefully that was helpful, and I hope you guys have a wonderful day, and I will see you in the movement class tomorrow. All right, take care. Bye.